In this video, we're going to be talking about the rhinoplasty procedure. And just remember that you will receive copies of all of these instructions at your office visit, so don't feel like you have to remember everything. As with all of our procedures, ice is very important. It's going to help both prevent and reduce swelling. So for the rhinoplasty procedure, it's usually easiest to use cold washcloths and just drape them across the nose and the lower eyelids. With this procedure, it's not uncommon to have bruising and swelling in the eyelid area. You will also sleep elevated. That means head above the heart at about a 45-degree angle. This allows gravity to do its job and bring that swelling downward. If you're laying flat, that swelling is going to stay right where it is. For most rhinoplasty procedures, you will have a cast or a splint on the nose. Don't remove this. Generally, Dr. Standifer will take this off at about 1 week after surgery. So just leave it alone that first week. We will give you a supply bag after surgery. It's going to have everything you need to care for your procedure except hydrogen peroxide. We're going to give you sterile water, sterile gauze, Q-tips, nose sprays, all kinds of things. Just know that you don't need any of those things until we see you at your appointment the next day. We're going to go through them step by step and teach you how to use them. For the nose sprays, there's going to be 2 different kinds of sprays. One is just a normal saline spray. You can use that around the clock if you need to. That's going to keep those membranes nice and moist. It's going to reduce discomfort and it's going to reduce the stuffy feeling. There will also be a decongestant spray like Afrin. This one you can only use twice a day. Generally, we only use it for that first week because too much of that spray is not always a good thing. But during that first week, it's going to help reduce the congestion and help you breathe a little easier. Typically, that's the hardest part of a rhinoplasty procedure, is that feeling of being stuffy, because we also can't blow our nose. Dr. Standifer will tell you when it's safe to do so. You can eat soft foods to your tolerance. Soups, smoothies, yogurt, applesauce, pudding, pasta, anything soft is fine. Avoid excessive salt though, because salt makes swelling worse. So be mindful of canned soups and processed foods because they typically have a lot of salt in them. You can shower anytime after we see you at your first follow-up appointment. Just make sure you feel up to it. If you're dizzy or lightheaded, just wait. But it is okay to get in the shower. It is okay to get your face wet. You won't hurt anything. Some things that are normal. People tend to feel worse before they get better. Usually around day 4 and 5, you have feelings of, why did I do this? This is not what I wanted. This is not what I expected. I'm not getting any better. It feels like it's been an eternity when it's really only been 4 days. So just know that your body is healing even if you can't see it. I always tell people, don't check the mirror every hour and expect to see changes. There won't be any. It's more of a day-by-day, week-by-week process. There's actually been studies that have shown that rhinoplasties improve even up to 5 years. They're still improving and changing. So we have to be patient. Some things not to do. Don't blow your nose. I already mentioned that. We don't want to increase pressure in that area. So Dr. Standifer will tell you when it's safe to do that. If you do have a cast or he did any work on the bone, you cannot wear glasses or sunglasses for 1 month after surgery. That's hard. So there are some ways around that. You can get an item on Amazon that actually holds the glasses away from your nose. You can order that if you want. Or you can just use tape. You wrap the tape around the glasses and stick it to your forehead so that it's not sitting on the bone. I know that's not the cutest option, but it is important in making sure you get the best result possible. No exercise for 2 weeks. We don't want to increase the heart rate or the blood pressure. You can do light activity like walking or light chores around the house, but nothing strenuous for 2 weeks. And of course, if you have any signs of infection, like something is really red, something feels hot, you have pus or a fever, call us. I always tell people the easiest way to prevent infection is common sense. Wash your hands frequently. Use clean linens, clean towels. If everything's nice and clean, that's going to greatly reduce the risk of infection. So that is pretty much everything. I do like to tell people with the rhinoplasties, I like to reiterate that process takes time. You are not going to see the final result at 1 week or even at 1 month. So we have to be patient and we have to be realistic with our expectations. As always, you can watch this video again if you want, and you will have plenty of opportunity to ask us questions in the office, and you can always call too. See you soon.